In First Aid 1, you will learn about some of the equipment and actions associated with providing first aid in the workplace. There will be knowledge checks at the end of each topic, followed by a test your knowledge at the end of the module to test your knowledge of the material. This module requires approximately 30 minutes to complete. After successfully completing this module, you will be able to describe OSHA-compliant first aid kits, explain the evaluation of an injured or ill person, list the methods used to control external bleeding, explain the treatment of minor burns, describe how to care for head, neck, and spinal injuries. In Topic 1, First Aid Kits, you will learn to describe OSHA-compliant first aid kits and the supplies they contain. The knowledge check question at the end of this topic will assess your comprehension of first aid kits. This topic requires approximately 6 minutes to complete. First aid kits are critical to the health and safety of employees and can even make the difference between life and death. The nature and amount of supplies required depends primarily on the type of industry involved and amount of employees they are meant to serve. The American National Standards Institute, or ANSI, develops a minimum supply requirement for small businesses, which OSHA then adopts and expands. Specifically, OSHA requires first aid training and supplies for facilities with no on-site infirmary or hospital in close proximity. The employer decides the exact inventory of the kit based on the hazards to which their employees are exposed. But it is highly encouraged that the OSHA and ANSI recommendations are followed as well. The following are common items found in most first aid kits, although many other items may be included that are specific to the workplace. Gauze pads of various sizes, as well as rolls of gauze, are used to dress wounds or burns. Usually made from cotton and covered with a porous plastic film, gauze allows for wound covering and compression without sticking to the wound as other materials will. Gauze can also be impregnated with ointments and salves to aid in the healing process. For smaller wounds, adhesive bandages are a fast and simple way to provide protection and promote healing. These bandages come in a wide variety of shapes, sizes, and materials, some designed for very specific areas, such as fingertips and often flexed joints. Antiseptics, such as alcohol, hydrogen peroxide, and iodine, are used to clean in and around wounds. They are primarily used to prevent the risk of bacterial contamination, which could otherwise lead to complications like infection, sepsis, and putrefaction. Soap and saline solutions are also used to clean wounds and wash out eyes, but rely on mechanical means to work rather than biological. Small hand tools such as trauma shears, tweezers, lighters, and pen lights are often included in kits to serve a variety of functions. Thermometers, irrigation syringes, and cold packs can also be valuable to have on hand. Many kits include devices to aid in maintaining a victim's respiration. These include resuscitation bags and nasal or oral airway adjuncts. The bags allow a responder to breathe for a victim by compressing an air-filled chamber, while pocket masks allow rescuers to perform CPR without the risk of spreading infectious bodily fluids. Medical tape can be used to affix gauze around a wound, attach a splint, or for a host of other uses. Medical tape typically is made of a breathable material and has a hypoallergenic, gentle adhesive. Most kits will contain at least one emergency blanket, also known as a space blanket. Good for a variety of uses, these blankets are waterproof and windproof, will maintain a victim's body heat, and can be used to shade an injured person if outdoors. Surgical gloves, face masks, and sometimes even goggles and aprons are provided to prevent the spread of blood and fluid-borne infection. A variety of medicines can be found in first aid kits. Most include painkillers, medicines used to treat symptoms such as an allergy and diarrhea, poison treatments, topical creams and ointments, and life-saving drugs such as aspirin and epinephrine injectors. Knowledge check. Select the appropriate answer and click the Submit button located in the lower right-hand corner of this screen. In Topic 2, Evaluating Injured or Ill Persons, you will learn to explain the evaluation of an injured or ill person. The knowledge check question at the end of this topic will assess your comprehension of the evaluation of an injured or ill person. This topic requires approximately 6 minutes to complete. The first and by far the most critical step when providing first aid in an emergency is the evaluation of the situation. Even with the best of intentions, a responder who rushes into action without fully understanding the circumstances has a high probability of making the situation worse, perhaps fatally so. Therefore, it is of vital importance that certain conditions are quickly understood and several important steps followed. Click on the tabs to the left to learn more. The very first thing that must be done upon approaching the scene of an accident or injury is to assess the situation for danger, both for the injured person and for the responder. For example, if an unconscious person is laying on the ground due to an electrical shock and their body was covering the still energized wire, simply rushing to the victim would only turn the would-be rescuer into a victim themselves. The goal is to prevent further harm from occurring to the victim and prevent any injury from happening to the responder or other onlookers. As soon as the situation can be judged safe, the responsiveness of the victim must be determined. If they can respond, they must be asked if they require help. Regardless of the level of severity of their injury, if the victim is coherent and declines assistance, a responder is legally bound to cease any first aid efforts. However, if the victim is unresponsive, unconscious, or obviously mentally infirm, their implied consent is assumed. Consent for aiding children is implied as well, but permission must be given by their parents or guardians if they are present. Always, the first thing to do when dealing with an unresponsive victim is to call 911 or other emergency response personnel. After determining assistance is required, the responder checks the ABCs of first aid, or airway, breathing, and circulation. The victim's airway must be ensured open and free of obstruction. First, open the mouth to check for and remove any obstruction present. Then, open the airway by carefully laying the person on their back, tilting their head back with a palm on their forehead, and lifting their chin. To check for breathing, one must look for the rising and falling of the chest, listen for the sound of breathing, and feel for breath. Circulation must be determined by checking for a pulse, typically the carotid artery in the neck. Other important conditions to look for at this point include large amounts of bleeding, the onset of shock, or any other life-threatening issues. In Topic 3, Controlling External Bleeding, you will learn to list the methods used to control external bleeding and about blood-borne pathogens. The knowledge check question at the end of this topic will assess your comprehension of the methods used to control external bleeding and about blood-borne pathogens. This topic requires approximately 6 minutes to complete. External bleeding is the loss of blood from any blood vessels in the body to outside of the body itself. A wound causing external bleeding can be a simple cut or scrape on the fingertip, or a potentially fatal severed artery. Luckily, stopping most bleeding can be relatively simple. The following steps discuss the methods for treating external bleeding, both for a minor injury and for severe bleeding. Click on the numbered buttons below to learn more. The first action to take is to apply pressure to the wound in order to slow or stop the bleeding. Avoid placing any material that is dirty or could potentially contain hazardous substances over the wound. Maintain pressure while performing the rest of the following steps. Have the victim sit or lie down. If the wound is serious, have them lie with their feet elevated and head below their trunk if possible. They also may need to be covered to maintain their body heat if shock begins to set in. If possible, elevate the wound above the heart to slow bleeding. If a broken bone is suspected, do not raise the limb, as more damage would likely occur. Using sanitizing wipes, alcohol, or simply soap and water, clean any dirt and debris from the wound and around it. However, if a large object, such as a screwdriver or metal fragment, is embedded, do not remove it, as the part of the wound it is sealing will be uncovered and begin to bleed as well. Instead, clean around it and continue treating the wound while stabilizing the embedded object from any movement as much as reasonably possible. Place a sterile bandage or dressing on the wound and firmly apply pressure. If necessary, wrap the bandage around the limb to aid in maintaining pressure on the wound. Bleeding from a damaged artery may necessitate the use of pressure points to slow the flow to a manageable level. The brachial, femoral, and popliteal arterial pressure points are often used to minimize bleeding from the arms, thighs, and lower legs, respectively. Without lifting the dressing from the wound, periodically check to ensure the bleeding has stopped. If it appears that the dressing is going to be soaked through, do not remove the original, but simply apply another on top of it. If a minor wound refuses to clot and bleeding continues, it may be necessary to seek medical attention. With major wounds, 911 or other emergency personnel should be contacted as soon as possible and concurrently with giving aid. Maintain pressure and monitor the victim until help arrives. If absolutely necessary to save a life, a tourniquet may be used by tying a cloth or other material around the limb between the wound and the heart, then tightening it by twisting a strong, straight object through it. A tourniquet should only be used to prevent death, as the use of one can lead to gangrene or the loss of the limb. Blood-borne pathogens are microorganisms that are present in human blood and are capable of causing disease in humans. Understanding the risks associated with blood-borne pathogens, how they are transferred, and how they can be protected against is vital knowledge for anyone administering first aid. Click on the tabs below to learn more. The blood-borne pathogens that are of highest concern include the human immunodeficiency virus, or HIV, hepatitis B, and hepatitis C. While many other pathogens of this type exist, the severity and prevalent nature of these three place them at the top of the list of worries for those at risk. As the name implies, blood-borne pathogens are transferred when someone comes into contact with the blood of a person who is infected. However, other bodily fluids, such as saliva, also pose a risk due to the small amount of blood cells they contain. Infection can occur both by direct contact with the injured person's bodily fluids and by handling any materials that have come into contact with their blood, which is considered a hazardous material. OSHA requires any employee that is likely to come into contact with potentially infectious fluids in the due course of their jobs to receive training on the subject, protection against exposure, and sometimes even vaccines. There are many ways to protect oneself from unnecessary exposure to blood-borne pathogens, even while aiding an injured and bleeding person. Wearing personal protective equipment, or PPE, such as latex gloves, goggles, and surgical masks, precludes contact with potentially infected blood. Hands and other areas that potentially came into contact with blood should be thoroughly washed with antibacterial soap and warm water, even if gloves were worn. Using respiration bags and pocket masks allow CPR to be given without direct mouth-to-mouth contact. Always ensure everything that is potentially exposed, including bloodied clothing, materials, and anything sharp, gets disposed of properly as hazardous material, or hazmat. Knowledge check. In Topic 4, Minor Burn Treatment, you will learn to explain the methods used to treat minor burns. The knowledge check question at the end of this topic will assess your comprehension of the methods used to treat minor burns. This topic requires approximately 6 minutes to complete. Burns are very common injuries, both in and out of the workplace. There are 3 classifications of burns: first degree, second degree, and third degree, each with their own symptoms and methods of treatment. Click on the tabs to the left to learn more. First-degree burns are the most common and least serious of the 3, affecting only the first layer of skin, or epidermis. A first-degree burn will result in a red discoloration of the exposed area, accompanied by some pain and possibly mild swelling. A typical sunburn is a good example. To treat a first-degree burn, run cool water over the area until pain subsides, and apply a moist, loose bandage as necessary. Topical burn ointment may be used, but never apply butter or oil, as they will trap heat in the skin. A second-degree burn is more serious than a first-degree, and can also be the most painful of the three. Second-degree burns appear red and possibly molted, with a high probability of blisters. Large burns, or those located on the face, neck, hands, feet, and groin, are considered the most severe. Treatment varies by the situation. If possible, the area should be cleaned to prevent infection. A cool, moist compress can be applied for short periods of time, but running water should be avoided due to the pain it can inflict. A dry, loose bandage should be applied if possible, and painkillers are recommended. The victim should be monitored carefully for shock and taken to an emergency room immediately if their condition worsens. A third-degree burn is the most dangerous of the three and must be given emergency medical treatment as soon as possible. The skin often appears white, charred, or leathery, and can involve very little pain itself, as the nerve endings can be completely destroyed. The victim must be watched closely due to the high probability of shock, which can be minimized by keeping the burned area above the heart. Do not remove charred clothing or other materials from the wound, as bleeding and infection could occur. Otherwise, third-degree burns are treated in the same manner as second-degree. Knowledge check. In Topic 5, Head, Neck, and Spinal Injury Care, you will learn to describe how to care for head, neck, and spinal injuries. The knowledge check question at the end of this topic will assess your comprehension of the methods used to care for head, neck, and spinal injuries. This topic requires approximately 6 minutes to complete. Injuries to the head, neck, and back can cause major and permanent damage to the spinal column. Although given with the best of intentions, improper first aid administered to someone that has suffered a spinal injury can result in paralysis or even death. Knowing the warning signs and how to respond properly will prevent a responder from making a bad situation worse. Click on the tabs to the left to learn more. Some signs that a person has suffered spinal injury include a fall on their head, neck, or back, severe pain in neck and or back, neck or back at an unnatural angle, victim's inability or refusal to move neck, weakness, numbness, or paralysis, lack of motor control or inability to control bowels, head injury with effects on consciousness and focus. Administering first aid to a person with a possible spinal injury must be done with the utmost care to not exacerbate the situation. Ensure 911 or other emergency personnel are called immediately. Above all, the victim should never be moved unless absolutely necessary to prevent further injury from occurring. Attempt to stabilize the head and neck by placing rolled-up towels or the equivalent on either side of the head. If the victim is not breathing, CPR can still be administered, but instead of moving the head back to open the airway, the jaw should be gently pulled forward. If the victim must be moved to avoid danger, It has to be done in a way to prevent any bending or movement of the spine. While holding the head immobile, pull on the shoulders, both hands, both feet, or their clothing. Under no circumstances drag the victim to the side. Only pull in a straight line. If they must be rolled over due to vomiting, a minimum of 2 people, one on the upper body and one on the lower, must roll them over at the same time as to keep the spine aligned. Knowledge check. In this module, you have learned to describe OSHA-compliant first aid kits, explain the evaluation of an injured or ill person, and list the methods used to control external bleeding. You have also learned to explain the treatment of minor burns and describe how to care for head, neck, and spinal injuries.